am Dr. Kay Fontana, life force coach and grief recovery specialist, and I am deeply familiar with the pain of loss, having experienced many throughout my life. At just 9 years old, I lost my brother to cancer and witnessed my parents' immense grief, which was unbearable. Years later, my mother lost her battle with Alzheimer's, and then my father was diagnosed with cancer and passed away a week after his diagnosis. Most recently, in January 2023, I experienced the devastating loss of my husband and soulmate of 40 years due to multiple health issues. In between were countless other losses, including family members, friends, co-workers, beloved pets, and even finances. However, I turned my pain into my purpose and passion to share strategies to help you get through your darkest days and navigate the complexities of grief. This is the Healing Our Grieving Hearts podcast. Welcome to today's episode where I will be diving into a sensitive but essential subject, how to talk to children about death. This can be one of the toughest conversations for adults to have, but it's an important part of helping children understand and cope with loss. First, let's consider how children perceive death at different developmental stages. Young children between the ages of 2 and 5 often lack a clear understanding of death as a permanent state. At this age, they might view death as something temporary, assuming that the person who has died will eventually come back. Their perception is often shaped by the magical thinking common in early childhood, where concepts like returning to life may seem possible. This lack of understanding can influence how they process loss and grief. Children ages 6 to 9 start to recognize that they too will eventually die, a realization that becomes more defined as they grow older. Their cognitive development allows them to shift from the magical thinking characteristics of early childhood to more logical reasoning. As they begin to comprehend the permanence of death, they might experience fear surrounding the idea of mortality. This awareness also equips them with the ability to mourn and process their emotions related to loss. To provide some context that I briefly mentioned in the introduction, when I was 9 years old, my brother died of cancer, melanoma to be exact. If I remember correctly, he was diagnosed about 6 months before he died. At that time, my parents had to drive him to California weekly for his cancer treatments, as Arizona didn't have any treatment facilities available. During these trips, my sister and I stayed with our grandmother. I vividly recall one day coming home from summer day camp at our local park to discover that my parents had taken Craig to the hospital while I was away. When they returned, they shared the devastating news that Craig had died. In that moment, I was at a loss for how to react or what emotions to feel. I was old enough to understand that death was final and that my family, including myself, was not immune to it, but was also in disbelief that he wasn't coming home. My parents struggled to communicate with me about death as the grief was unbearable to them. My sister, being 6 years older, was able to grasp the concept. However, because she was only a year younger than Craig, she was also deeply affected by the loss because they were so close. The absence of open conversation about death left me feeling scared and confused. I was also angry because no one shared with me the gravity of his illness. I feared going to sleep at night, worried that I or my parents or my sister might also die. Since Craig's death was never addressed, I developed my own belief that discussing it with anyone, friends, teachers, and classmates, was off limits. This led to a constant anxiety that someone would inquire about Craig and I wouldn't know how to respond. I shared this personal story to highlight the importance of these conversations. If we avoid discussing the reality of death with children, they will often create their own narratives, which may not reflect the truth or provide any comfort to them. Understanding where a child falls on the developmental age spectrum is important in shaping how we approach conversations about death with them. Each stage of a child's growth brings unique perspectives and comprehension levels, allowing parents and guardians to tailor their language and explanations in a way that is both age appropriate and sensitive to their emotional needs. Before initiating this important discussion, it's essential to provide a safe and welcoming environment. Select a quiet and comfortable space where you can talk without interruptions. This setting will also put you and the child at ease. It's important to approach the topic gently, using warm and reassuring language. Be prepared to listen actively, allowing the child to share their thoughts and feelings as much as you express yours. This two-way communication can help them feel supported and understood. So here's a few tips to prepare. First, be honest. Honesty is crucial when discussing death with children, as they can easily sense when adults are not being truthful or withholding information. Use language that is appropriate for their age and comprehension level to ensure they understand. Clear and straightforward explanations can help dispel confusion and prevent the development of misconceptions about death. Transparency builds trust and provides a solid foundation for future discussions on this sensitive topic. It's important to use clear and factual language when discussing death, using words like death or died. Being vague can create confusion for children. Phrases such as, we lost him, she passed away, he's gone to heaven, or she's gone to sleep might lead the child to question when the person will come back or cause them to fear sleeping themselves. Similarly, expressions like, he's gone to be with Jesus, she's in a better place, or God needed another angel could prompt children to worry about whether they too will experience the same fate and why these religious figures would take them away from their families. The second tip is to stay calm. Maintain a calm demeanor is essential during conversations about death, as your emotional state can significantly impact how children perceive the discussion. When you approach the subject with composure and reassurance, children are most likely to feel safe and secure expressing their feelings and concerns. A peaceful environment encourages them to ask questions and share their thoughts freely, which can facilitate a more meaningful dialogue about their emotions and understanding of death. The third tip is to think about their questions. Anticipating the questions that children might have is an important part of preparing for this conversation. Children are naturally curious and may seek clarification or express concerns about aspects of death they don't understand. Be ready to answer their inquiries thoughtfully, and remember that it's perfectly acceptable to acknowledge that you don't have all the answers. Responding with honesty, such as saying, I don't know, can encourage openness and help children understand that it's okay to explore difficult subjects together. A while ago, I was a facilitator for a grief program designed for children who had recently lost a close family member. This family-oriented program included separate groups for parents and children organized by age. The activities were tailored to these groups and included arts and crafts, music, play, and discussions about death. One of the key messages we conveyed to parents was the significance of clear communication with their children, encouraging them to use the terms death and died when discussing loss. The program was truly impactful and achieved great success. When initiating this sensitive conversation about death, consider referencing a recent event that resonates with the child, such as the loss of a beloved pet or notable passing in the news. You might begin by saying, I heard about for instance, Susie's dog dying. It reminds us that sometimes people or animals die, and that's a part of life. This approach can help ease into the topic naturally. Encourage the child to express their thoughts and emotions, creating an open dialogue. Pose open-ended questions to invite deeper discussions, such as, what do you think happens when someone dies? Or, how do you feel about what we talked about? These questions allow children to articulate their feelings and beliefs, providing you with valuable insights into their understanding of death and any misconceptions they might hold. Listening attentively to their responses is important, as it not only shows that you value their feelings, but also helps you guide the conversation in a constructive way. Validating a child's feelings is vital when discussing death, as it helps them understand that their emotions are acceptable and normal. Whether they express sadness, anger, confusion, or even indifference, reassure them that whatever they feel is okay. Sharing your own feelings can also be beneficial, as it normalizes their emotional response and helps them see that it's natural to experience a range of emotions around loss. If the conversation brings up fears or anxiety, gently reinforce that these feelings are completely normal. Offer comfort by assuring them that they are safe and supported, not only by you, but also by others in their lives. This supportive approach creates an open environment where children feel comfortable sharing their thoughts and emotions without judgment. Keep in mind that discussing death is not a one-time conversation. It's an ongoing dialogue that evolves as children grow and experience different kinds of loss. Look for opportunities, such as anniversaries or special memories, to revisit the topic and invite discussion about grief and remembrance. Introducing rituals like lighting a candle in memory of a loved one can offer a concrete way to honor those who have passed and can naturally encourage further conversation. This practice not only allows children to express their feelings, but also creates an environment where discussing death becomes a normal part of their emotional development. There are numerous resources available to assist you in navigating conversations about death with children, making the process less daunting. Children's books specifically tailored to address a sensitive topic can be incredibly beneficial. For instance, titles like The Fall of Freddie the Leaf by Leo Buscaglia and The Invisible String by Patrice Karst gently introduce concepts of loss, connection, and the cycle of life in an age-appropriate manner. In addition to literature, it may be helpful to reach out to a grief counselor or therapist, especially if you are also coping with a loss. Professionals can provide valuable support, insights, and strategies tailored to your family's unique circumstances, which can further facilitate these discussions. While talking about death with a child might seem challenging, it ultimately presents an opportunity for growth, connection, and deeper understanding. By approaching the subject with honesty, compassion, and patience, you can guide children as they navigate their feelings about loss and grief in a supportive way. The mission of Healing Our Grieving Hearts is to help individuals navigate through loss and find purpose through grief recovery, energy healing, and spiritual support. For more information on how to benefit from grief healing modalities that I offer, go to my website at www.healingourgrievinghearts.com, where you can schedule a complimentary grief breakthrough session. You will also find 2 guided meditations on the media page. To follow me on Facebook, go to facebook.com/k.fontana. Thank you for listening to this episode of the Healing Our Grieving Hearts podcast. Remember, you are not alone in your grief, and your experiences and emotions are valid. Join me next Saturday at 10 a.m. Arizona time as we continue to explore the human experience and the intersection of grief and spirituality. Until then, be kind to yourself.